start this session, let's begin by invoking the blessings of our dear Amma. I invite the dignitaries to light the lamp of compassion and peace. I welcome Brahmachari Achyutamrita Chaitanya, Principal Amrita School of Spiritual and Cultural Studies. Brahmachari Nirbhayamrita Chaitanya, Mata Amritanandamayi Mat. Brahmachari Prabhamrita Chaitanya, Mata Amritanandamayi Mat. To light the lamp. ध्यायामो धवलावगुन्दनवतीं तेजोमयीं नैष्टिकीं स्निग्धापाङ्गविलोकिनीं भगवतीं मन्दस्मितश्रीमुखीं वात्सल्यामृतवर्षिणी सुमधुरम् सङ्कीर्तनालापिनी श्यामाङ्गीं मधुसिक्तसूक्तिम् अमृतानन्दात्मिकामीश्वरी It's better to hold a book between your fingers than to hold a cigarette. A warm welcome to everyone who have gathered here to be part of this great day of change, World No Tobacco Day. Before we begin, let me ask you something. Are you burning tobacco or is it burning us? You can ask that for yourself. World No Tobacco Day is observed by the World Health Organization to highlight the risk associated with the consumption of tobacco. Now, a fire at one end and an unhealthy body to the other, and a slight bit of tobacco in between. This is what cigarettes are. And to note one more fact, interesting fact, that cigarettes is the only customer product when used as directed kills its own customer. Nearly 1.35 million deaths are happening every year because of tobacco. It is our responsibility to take actions to make people get aware about the dark sides of tobacco. We all know that there is nothing permanent except for change. And to bring good knowledges in us, in all of us, is to change the quality in life. With that note, let's start the session with the oath taking ceremony. So, for that, I request Aditya to come.
I request everyone in the gathering to please rise for the oath. Please repeat after me. I pledge to not smoke or use any tobacco products. I pledge to motivate my family and friends to not smoke or use any tobacco product. I pledge to keep my university tobacco free and also pledge to motivate my peer groups for the same. I will be a positive role model for my friends and family and loved ones. I will encourage them to never start and to quit tobacco products. When someone I know decides to quit, I will fully support them and help them. Thank you, guys.
Thank you, Aditya. I hope everyone would be able to cope up with the change. Now, I invite Parvati Chaitanya of S4 EC to welcome our guest of honor.
Good afternoon, all. I'm honored for the privilege given to me. Our chief guest of the day, Dr. Raju Rajagopalan Nair, MBBS MD Anaesthesiology, Assistant Surgeon at District Hospital, Kollam. He has been dedicating his life for the service of people and has become a perfect role model for many of us. He attained his primary education in Mar Gregorius Memorial Residential Public School, Kottarakara. Following the path of service, he went to do MBBS at TD Medical College, Alapura. After his graduation, he went on to do post graduation in anesthesia and critical care at Pushpagiri Institute of Medical Science, Tiruvalla. It is with my immense pleasure and pride that I invite Dr. Raju to share his wisdom on this World No Tobacco Day. I invite you, sir.
No, no, okay, okay. Okay. Yeah, sure, sure. Om Shri Gurubhyo Namaha Harihi Om. Om Amriteshwariyai Namaha. Is it okay? So, I would like to begin with the quote of Amma. God gave us pen and paper. He offers hints on good and bad things. We would write, we could write, but allows us the freedom to choose. So, in Hindu scriptures, it says of Purusharthas, four Purusharthas. That is Dharma, Artha, Kama, and Moksha. Dharma means righteousness in every aspect, for every situation. The English meaning is limited though. Then Artha means earning money. There is nothing wrong in earning money, but it should be in righteous way. Comes Kama, means sensual pleasure, and that should be also in a righteous way. You can have a married life and have sexual pleasures, and you can have healthy and tasty food to please your taste buds, etc. And comes moksha, that means liberation. So here we are dealing with the tobacco products and all, no? So it comes to be the adharmic way. The tobacco has use of tobacco has become like an epidemic. The World Health Organization says the tobacco epidemic is one of the biggest public health threats the world has ever faced. And it has become increasingly fashionable to smoke, isn't it? Here you see in the movies, isn't it? A college guy would like to take a puff of smoke and feel himself like, Rocky Bhai, isn't it? Violence, violence. You would like to say it, isn't it? Okay. The stupid guy who does that doesn't know it's a nicotine in the tobacco that feels him elated, isn't it? That feels him elated and feels him like the Rocky Boy and all, and goes for that rash drive in the bikes, isn't it? So what happens with nicotine after you take a puff of smoke? Within 10 seconds, the nicotine acts on the brain, the central nervous system, causing release of neurotransmitters like dopamine and endorphins. So what are endorphins? Endorphins means endogenous morphine. I'm not going to take a medical class but still there has to be some part of it. Endogenous morphine. Endogenous means what? Anybody? What is endogenous? That is produced in the body, isn't it? Synthesized in the body. Nicotine stimulates the production of endorphins, endogenous morphine. And what is morphine? Anybody? Morphine. What is morphine? Anybody? Okay. Morphine is the queen of analgesics. It's the ultimate painkiller. Like it can be used for a coronary artery bypass surgery for the heart, sternal incision. The most excruciating pain that can be relieved using morphine that we used in anesthesia, isn't it? Morphine. Morphine is used also for terminally ill cancer patients. For a terminally ill lung cancer patient with very little viable lung tissue, we in palliative care we offer the patients oral morphine tablets. Oral morphine tablets so that they don't feel the sense of breathlessness. See, palliative care means no cancer patient or no terminally ill patient should feel the distress or pain. Understood? So that is palliative care. So in palliative care, we give the oral morphine tablets so that the terminally ill lung cancer patient does not feel the sense of breathlessness. So that he feels a sense of well-being even at the time of death. So that is morphine. And what is heroin? Heroin is a synthetic analog of morphine that we hear in newspapers, no? Lately on news was there regarding heroin. Anybody? Lakshadweep. Oh, kilos of heroin was smuggled from Pakistan to Lakshadweep. Lately news was there in newspapers and all. Worth millions of dollars, isn't it? So that is heroin. Why I'm telling you about morphine and heroin? Something similar to morphine is being released. It's not exactly morphine, something similar to morphine. It's all basically same chemical structure, opioid peptides. Something similar to morphine is released. That is called as endorphins by the nicotine. When you take a puff of smoke, the nicotine stimulates the release of what? Stimulates the release of what? Dopamine and dopamine and dopamine and endorphins. Yes, endorphins. So you feel a sense of well-being. You feel a sense of being elated. There are no psychedelic, no psychic experience, psychotic experience, or psychedelic experiences. Just a sense of well-being. The fun fact of with tobacco smoke is that the fun fact with tobacco smoke is that you don't know that you are getting addicted. That is a problem. You take one puff of smoke, you are actually getting addicted, but you never know because there are no psychotic or psychedelic experiences in it. But what happens is overall happiness score of the patient. When you take the score, the overall happiness score is on a decline, is or taking a dip. When you take a puff of smoke, you feel elated, isn't it? Then after, it comes down far below the baseline before it was. That's why people who quit smoking, there is a problem like depression. When you quit smoking, the biggest problem is like depression and anxiety. So I would like to discuss regarding other side effects of smoking. Work efficiency. I don't know why the picture is missing. There is a photo of one person taking push-ups, struggling to take the push-ups. Okay. Work efficiency. The uh, work efficiency is drastically reduced. Why? With smoking, for smokers. Why? When you do work, what happens? What is needed for work? Energy. For energy, there is metabolism at the cellular level, isn't it? Cellular metabolism in the tissues and all, isn't it? So oxygen is required, isn't it? Isn't it not? Yeah. How does the oxygen reach the tissue levels? No. Through the lungs, the oxygen comes into the body. Then oxygen is carried to the tissue level via hemoglobin in the blood, isn't it? There is something called hemoglobin in the blood. Through the hemoglobin in the blood, the oxygen reaches the tissues. Okay, when what happens when you smoke is that there is so much amount of carbon monoxide in the smoke. The carbon monoxide, mind you, it has got 240 times more affinity for hemoglobin than oxygen. 240 times more affinity for hemoglobin than oxygen. So what happens is oxygen is not carried by the hemoglobin. The tissues are deprived of what? The tissues are deprived of oxygen. So work efficiency decreases. There is exercise intolerance. You are not able to. So if you are playing tennis, if you are playing cricket, if you are playing football, and you smoke, what happens? You are doing push-ups. The number of push-ups decreases, isn't it? Because carbon monoxide. Because of the carbon monoxide, the tissue level oxygen is not there. The cells are deprived of oxygen. Understood? So why when you smoke, the work efficiency decreases. Why? Because there is so much of carbon monoxide in the puff of smoke. Understood? And other side effects. Okay, it's infertility that comes in females and erectile dysfunction. It happens, well documented. Erectile dysfunction in males for those who smoke. Understood? So occupy and all, the problem comes. Okay. Coming to the airways. The airways, what happens? There are so many amount of chemicals in the tobacco smoke. It all destroys what? The cilia in the airways. The cilia are what? Hair-like structures in the airways or the respiratory tract, which clears the airway of secretions and foreign bodies. So what happens to that smoker who takes more number of puffs? For a smoker who has just started smoking, within weeks of starting smoking, within weeks, all the cilia gets destroyed in his airways. So if there are any smokers amongst you, his respiratory tract is bald. Now bald means bald, bald hair. Bald hair. Java is simple and powerful. No, bald hair. Okay, like that, the respiratory tract of that smoker is bald. There is no cilia or no hair-like structures in it to clear the secretions. So what happens to them is, 1/4 of the smokers, they are suffering from chronic bronchitis, and in long-term chronic COPD and other respiratory problems. They are susceptible to what? They come in contact with the TB patient. There are so many TB patients around. When you go to the market, what happens? They are easily susceptible to what? Tuberculosis, isn't it? They will catch tuberculosis. Okay. Can anybody tell after how long time, if you quit smoking, after how much time will the cilia recover? Can anybody take a guess? Anybody knows after how much time somebody is quitting smoking and after how long? Anybody? Just give us a guess. Oh, actually, I was little worried about taking class in a big auditorium, but there is no response from you. Can anybody take Samiji? uh, yeah, yes. Still, the students are not guessing that. No, it takes 9 months. 9 months for the cilia to recover. 9 months. 6 to 9 months actually. 6 to 9 months to recover. If you quit smoking, the CLA will return only after 9 months. So these are problems for when you in anesthesia, when we take up patients for surgery, we have to take into account all this for a smoker. Understood? For somebody who's smoking, when we take a patient for anesthesia, we have to consider every system, including the airways. Airways a problem, spasms can occur. Like, understood? Okay, that's a different topic anyhow. Coming to the blood vessels, the chemicals in the puff of smoke, the tobacco smoke, destroys the inner lining of the blood vessels. And the nicotine vasoconstricts the blood vessels. And the platelets stick on to this damaged endothelium and a clot formation occurs, finally obstructing the blood vessel. And what happens after that? When the blood vessels get obstructed, what happens? Somebody speak aloud. What happens if the blood vessels are obstructed? What happens? Heart attack, very good, very good. Heart attack, stroke and all occurs, isn't it? So for chronic smokers and all, it gets into heart attack and stroke early age. Study shows that for a smoker, the risk of having heart attack is a technically false nomenclature, CAD, coronary artery disease, and stroke, the risk increases by 70%. Studies show that the risk increases by 70%. Anybody can tell what are the number of chemicals in a puff of smoke, tobacco smoke? Number of chemicals that are there. Carbon monoxide, I already told you. What are the number of chemicals? Can anybody tell? Speak aloud. Nicotine is there. Number of chemicals. Number. I am just a number. You can just take a guess. 1,000, 2,000. Like how many? How much? 21, 10,000. Any more? 10,000 is for. Still, the number of chemicals is more than 7,500. Okay. There are more than 7,500 chemicals in a puff of tobacco smoke. And that includes quinolones, cresol, cadmium, nickel, innumerable hydrocyanic acid is there. Many dangerous chemicals are there in a puff of smoke. And what happens? There are 7,500 chemicals there in a puff of smoke. And what it does to you is that makes you prone to cancer, isn't it? It destroys the DNA. And there is nickel and arsenic in the tobacco smoke, which inhibits the DNA repair. The chemicals destroys the DNA and it is unable to repair. Why? Because there is arsenic and nickel in the tobacco smoke. That's why the susceptibility to develop cancer increases manifold. In fact, smoking is the most common cause of cancer, isn't it? Now coming to alcoholism along with smoking increases the already told health problems by manifold. And also, if you are taking alcohol, the chances of you taking a puff of smoke also increases. Like in my experience, after I started drinking only, I started to smoke. Before, I should confess to you that I had taken alcohol and smoking and I smoked during my years in medical college. Stupidity, I would say, still. So what happened is that I had this nauseating avulsion for this tobacco smoke prior to drinking. Somehow I didn't like the smell of smoke. Somebody smoking, my friends are smoking. I had some avulsion. I don't know. I couldn't just stand the smell of that smoke. But what happened is that after I started drinking, I gradually tolerated the smell of tobacco smoke. And then finally I took one puff. And then another puff. And after that, many puffs. Then chain of puffs. And it was quite difficult to quit. I tried many times to quit. It was very difficult. And I will tell you how I did. So that's what alcoholism and okay. I would like to see this quote of Amma. Amma says, if you sincerely look into the mirror of our conscience means manasakshi, we won't have much problem overcoming our weakness and limitations. Okay. That's a few of the quotes that helped me quit smoking. And conscience, I would like to add one thing to you. Before I started smoking and drinking during my college life, I was a different person. I mean, I never tried to intentionally hurt others prior to drinking. I mean, but over 1 to 2 years, 2 years after drinking, I began to notice. I mean, Mama tells you should look into the mirror of your conscience. Once in a while, when I looked, I say I am intentionally hurting others. I think personality is changing. So one of the problems, social complications. Social complication with regard to alcohol, substance abuse, and all is what criminality, isn't it? One of the complication. If you drink and smoke, there is high likelihood that you are going to have a marital disharmony and other criminal behaviors. That's how much of neurobehavioral changes that happening in your brain. Your personality is changing. You never know. You're going down your line. Soon you will disregard your conscience. മനസാക്ഷിക്ക് വിരുദ്ധമായി ചെയ്യാനായിട്ടുള്ള നമുക്ക് പ്രേരണ ഉണ്ടാകും ഈ when we use these substances. That's what goes into criminality, I think so. So the scene has changed. A decade back when I smoked, the stuff was not available near the campuses. It was not available not in Alapiton. I studied in TD Medical College, Alappur. It was not there in Alapiton. As a medical student, we know what happens when you smoke this. We study what are the side effects, what are the effects, And I wanted to try out of sheer stupidity. I just want to try because it is written when you smoke, stuff means is ganja. When you smoke, there is some floating sensation. I was just enjoying my college life in stupidity, okay. I wanted to give a try. When we entered, it was not available there. But now, when my cousins tell me it is there available near every campuses, school campuses, near the school campuses, near the college campuses, this stuff is available. There are some drug peddlers have increased like anything. I hope you know, isn't it? Am I right? Am I right? No, really? That will be fine. Probably because it's Amrita Vidyalaya. In Amrita campus. Very good. Okay. Then, so I would like to educate you on a few points regarding ganja. I mean, stuff. Do you have a doubt? Please feel to ask. Don't giggle. Please feel free to ask. Any doubts? What is this thing? What is this stuff? I think, isn't it? Any doubts? Okay. When you take this puff of smoke of ganja, what happens is the person will have red eyes, conjunctival congestion, we say, and dry mouth and tears without any emotions. Tears will be there. That's what happens basically. And then it's all psychic experience, psychedelic experiences like. It's basically the psychoactive substances, cannabinoids, tetrahydrocannabinoid. That's the active ingredient, the marijuana. It causes it is basically torturing your brain, destroying your brain. It's basically freaking you out. You're going to become a psycho. When if you come into contact with somebody offering you, maybe you're a smoker, already a smoker, there is high likelihood that somebody will offer you the stuff or this ganja. This is the worst thing that is available. It basically these psychoactive substances. Understood? It is basically destroying your brain. You are going to become a psycho basically. So what happens after a puff of smoke of ganja is that these are things that happening. Red eyes, dry mouth, then splitting of the consciousness can occur. That means you will feel as a different person experiencing the intoxication. There is a splitting of your consciousness. That's what basically happens. Then floating sensation. I actually tried this once. Out of sheer stupidity, I tried. I wanted to know what this floating sensation. I studied in my textbooks floating, but it never happened actually. What happened to me is that acute anxiety happened to me. Acute anxiety with sheer distress, a burden of thoughts. Actually, it started with lightheadedness. Later on, it became heavy-headedness. And that's what happened to me. I had this acute anxiety attack. Okay, then what happens is some persons can have run amok. That means after smoking this ganja, this fellow will what will he do is he will go on hitting everybody who comes into his eyesight. Okay, he will take a car, he will go on a rampage, he will hit somewhere, This has happened in, I know in campuses this has happened, run amok. My brother is also a doctor. When he was a medical student, when I became a doctor, this happened to a junior of him. Run amok, this happened. I know reports of run amok cases happening in campuses. Then is transient psychosis can occur after a smoke of ganja. Paranoid psychosis. And after chronic use of this thing, cannabis psychosis or hemp insanity can occur. Schizophrenia, what all things can be taught about psychosis. Basically, you are becoming a psycho. So beware, never try this thing even for testing or for experimentation. Never try. It's basically torturing your brain, destroying your brain. Okay, so when you, dear friends, when you see somebody smoking, this is a reality. I know I have included in TKM campuses in Kerikode. Many of my cousins are studying there. This thing is available in many campuses, nearby school campuses, especially near this not mobile shops and all. I'm not telling the source, but it's a fact. Okay. So somebody is smoking. He is also inadvertently at one point of time going to smoke things because it is cheaply and readily available now. This thing, ganja. Okay. So how can you quit smoking? A few points. Like avoiding situations is the first thing. When you have decided to quit smoke, you have to avoid the situation. How can you avoid the situation? Most of your friends will be smoking. How will you avoid the situation? You can tell a lie, like I got a throat pain, so I am quitting smoking for 1 week. Like you can tell a lie for, or you can tell you are having cough, some problem with the chest. X-ray was taken. There is some problem. For somebody smoking, X-ray taken. Sure, there will be some problem. So you don't be a lie if you're telling that there is some problem in the X-rays, chest X-ray. Okay. So you can tell your friends, I am having some chest problems, so I am quitting tobacco sometimes. So they won't offer you. And you can, or else you can tell you have got that nauseating experiences. For those who are not smoking, you can tell your friends smoking, you have got that nauseating aversion for the smoke or smell of smoke. Okay, that is help. Then if you are having withdrawals after quitting the smoking, depression, anxiety and all, there is nicotine replacement therapy. The nicotine patch, transdermal patch will be placed so that there will be baseline nicotine level. It helps you with the withdrawal symptoms. Then there are nicotine lozenges, gums, tablets, etc. In counseling and support groups helps exercise. Why exercise means? Exercise means you are working out in a gym. You are, there is some amount of endorphins are released during exercise. That exercise helps you with the depression. Exercise is a regular daily exercise is a treatment modality for helping depression. Understood? So some amount of endorphins are released during exercise. Sama says, the world is a slippery rock. Step carefully. Proceed on life's journey with awareness. Any questions, any doubts, anything, please feel free to ask.
Thank you, sir, for this wonderful and informative session. Now, I would like to open the Q&A session. If you have any question or something to share with sir, go on and shoot. Any question?
Yeah, Namashivaya to everyone present here, and my humble pranams to my gurus, doctor, our chief guest here. So I would like to start my question with a quote of a Buddhist monk. To every man given is the key to the gates of heaven. The same key opens the gates of hell. So it is science. So my question is, in India, you said pain and palliative clinics, right? So in medical science, we all know that the opioid drugs are the best painkillers. So the quantity of the opioids available per patient a week in India is actually comparatively less compared to that of Canada. So I have read an article that the patients are actually suffering with pain. Yeah, that's my first question. So in India, because of the drug ban, most of the this kind of substances are completely banned instead of controlled. For example, marijuana. So I need an answer. Thank you.
Yeah. Are you finished?
Yeah, I have one more question.
Yeah. Okay. Can I do it with the first question, and later on we can carry with the second?
Yeah, sure.
Okay. First thing, it is not opioid, it is opioid.
Sorry, sir.
Okay. Then in palliative care, many liberalization is already in place. Especially in Kerala, it is the best palliative care that we are already doing under the sheer leadership of Dr. M.R. Rajagopal, father of palliative medicine in Kerala. Similar palliative interventions are to be in place, to be done in all over India. Are you listening? Okay. Well, the problem with the ban and all is that if this thing goes in the wrong person, you know what happens, isn't it? It has to be there with the medical persons, isn't it? Palliative care means the oral morphine tablets. I have given to a terminal lung cancer patient. So we do the home visits. No, I have gone to a patient with terminally ill. I have gone to for I have gone for home visit for a terminally ill lung cancer patient, and we have offered and I have seen the patient. There is only very little viable lung tissue, but the patient doesn't feel the sense of breathlessness. That's it. So it has to be in the right hands. If it goes to the wrong hands, you know what happens when you lift the ban on guns. What happens in America? You know, United States. What happens? Yeah, you won't be there the
School
next.
shootings.
Yeah, shooting. That happens. That's it. What's the next question?
My next question is, marijuana is a psychoactive drug, right? So, but then it is actually used in other countries for medical purpose. Like hemp oil is really good for recovering from seizure patients and all. But why isn't the legal medical marijuana that isn't available in India?
Yeah, marijuana for seizures. I'm not sure.
Not
Maybe it's some.
marijuana. See, there are two types, sir. That is THC is the one that is psychoactive. There is a non-psychoactive too, right? That is DTC. What is that?
THC, tetrahydrocannabinol.
Yeah, that
Yeah.
is a psychoactive. There is a non-psychoactive form too for marijuana.
Okay.
That is used in hemp oils.
No, currently we are in the era of evidence-based medicine. There got to be evidences. There are level of evidences. You are doing thesis work and all. I think so. Are you doing thesis work and all?
No, no,
No.
sir.
So you don't probably you are not that quite familiar with evidence-based and all. There are level of evidences, case studies, case reports. Then there are randomized control trials. Then there are meta-analysis. Meta-analysis is the highest evidence of as of now. So everything is based on evidence-based medicine. There has got to be some evidence. Otherwise, we won't do.
There is evidence though, but our our government has to comply. Yeah, that's it. Thank you, sir. Thank you so much, and I'm sure.
Yes, sir.
Namaskar, sir.
I'm sure.
Sir, my question is, how did you quit? That's all.
How did you quit?
Yeah.
She is asking regarding my experience. Okay. Yeah, I had in fact become a chain smoker during my fourth year or so, my third year. Daily I used to smoke like 30 cigarettes a day. Yeah. Then I decided to quit, but I was unable to quit. I tried many times, there were failures, and then I used to do Dhamma's quotings just as a toddler falls many times before finally walking. Failures are the stepping stones of success. There was one quote that helped me. And I had tried this cannabis only once. I got that acute anxiety attack. And after that, I had that heavy burden of thoughts in my head. Next day, I confided my problem with a senior of mine. He's now an oncologist in MMC. He took me to Ambalapura Swami temple the next day, but that had some problems. I was not really able to tell you what. I tried this cannabis, many puffs I took. There was a problem of some obsessive thoughts coming again and again and disturbing me. There was no compulsory act. I have studied the psychiatry and all. I knew what is OCD. OCD means, what is OCD, obsessive compulsive disorder. Anybody? Anybody? Yeah, OCD means you feel you have got dirt in your hands. You wash your hands, but you still feel there is some dirt in your hands. That thought coming again and again is what obsession. What is a compulsory act is that you will wash again. Understood? So I had in this compulsive problem, but this obsessive thoughts were coming again and again. I was burdened with the heavy. I was troubled with the heavy burden of thoughts in my mind. And the next day, I went to Swami temple, Ambalapura Krishna Swami temple. Following day, I came to Amma. I received a mantra from Amma. I repeated mantra many times. Finally, relieved of everything, I was able to quit my smoking. That is what happened. Okay. But I would suggest you to, if you have any problem with quitting smoking, you should seek the help of Amma. Okay.
So I also have a question.
Yeah, sure.
Um, how yoga can help in quitting tobacco?
Yoga. I'd say it's in yoga, pranayama, meditation. I am meditation technique and exercise and all. Endorphins are released basically. Endorphins. The problem with the tobacco smoke is that nicotine stimulates the release of endorphins. This is dopamine and endorphins. It's a documented thing is that in exercise, yoga and all this endorphins are released. It helps. That's well documented thing. That's it.
Thank you, sir.
Any other doubt?
Yes, sir.
Sure.
Sir, like nowadays, like from the after 10th itself, the students are going and taking smoking, right? They're choosing to smoke. So how can we change it from that route? To change something, we have to start from the root, right? So how can we change such youngsters? How can we make a way for them?
Youngsters, these classes should be done at the preliminary school level and all. Children should be taught what is the danger of even a puff of smoke.
Like the youngsters are like, it is like everyone is sharing. Like it is ലൈക്ക് എന്താ പറയുക, ലൈക്ക് നമ്മൾ പെട്ടെന്നാണ് ഇത് മറ്റുള്ള ആൾക്കാരിലേക്ക് എത്തുന്നത്. എല്ലാവരും പെട്ടെന്ന് അഡോപ്റ്റ് ചെയ്യുന്നുണ്ട് സിഗരറ്റ്സ് എന്ന് പറയുമ്പം. ഇപ്പോൾ ഒരു ഫ്രണ്ട്സ് കൂട്ടത്തിൽ ഇരിക്കുകയാണെങ്കിൽ പോലും ദേ ആർ ചൂസിങ് ഇറ്റ് വെരി ഫാസ്റ്റ്, ദേ ആർ അഡോപ്റ്റിംഗ് ഇറ്റ് വെരി ഫാസ്റ്റ്. സോ ഹൗ ക്യാൻ ദാറ്റ് ബി ചേഞ്ച്ഡ്?
I think I could suggest only classes like this, bringing awareness into them. I mean value-based education and all. That's the we have to whenever there is a problem, we have to address at the root level, isn't it?
Yes, yes.
Isn't it? We have to address at the root level. So basically, there have to be value-based education has to be given to the school children at the school. That is done in Amritapuri schools, I know. Okay.
Yes, sir. Thank you.
And another thing is that when if you're only 8 of you and 7 of you smoke and all the rest of them smoke, you have to stand on your foot, on your values. I mean, you have to be there has to be some amount of vertebrae, strength of your vertebrae to stand without smoking. That's it actually.
Is there any other questions to ask, guys?
Sir, as far as I know, like
if a person used to smoke and you used to cross that person, you also used to feel like coughing and issues. So, what used to be chances of you getting infected because of that person is smoking, and like kind of there are contagious disease also, which used to separate between smoking and all stuff.
No contagious disease, I won't say. A smoker is susceptible to infections. But it's a thing that is fact thing. But passive smoking is also dangerous. It is bad.
Actually, sir, if I used to pass someone who is smoking, I used to generally get like coughing and all, like chest used to be kind of like block, kind of like coughing used to be very common for me. So the doctor had advised me that never go to those persons.
Yeah, it's better never to go. Yeah, keep distance.
So because of that thing, I want to
Even if
ask
you,
that it
Amma
is.
says, even if you go into a charcoal factory, even if you don't touch it, still there. If you come, when you come out, there is some, isn't it? There is so much of charcoal on your body. So it is always better to keep from.
So there
keep
is
close
no
to.
contagious disease regarding that.
No contagious disease. No, there
Okay,
is
sir.
not.
Thank you, sir.
Hi sir, this is Ajay. Sir, what are the strategies to stop smoking?
Strategies to.
Stop smoking.
First thing, you have to make a strong. I had to get a strong willpower that you are going to smoke. You know why? What are the reasons you are going to quit the smoking? You have to look into your conscience, and you have to be aware what are the problems you have to know. Then next thing is that avoid the situations. Like if your friends are smoking, no, there is so much amount of peer pressure coming from them. I have a smoke. Why are you not smoking? Why are you sitting like this? They will ask you, isn't it? So peer pressure dialogue will be, why are you not smoking? Why take one puff? They will ask you. So you have to tactfully avoid the situation. You have to tell, I got some throat pain or the some. You have to tell, I got chest problems. X-ray was taken. There was some problem in the chest. So I had to quit smoking for a while at least. Like after a while, you will be able to quit smoking. If you smoked like hell, craving, withdrawal symptoms are all will come up. If you smoked so much, then you will have to get nicotine replacement therapy and all to tide over the withdrawal symptoms. There will be depression and all. I had faced depression after, but Amma was there. Mahatma's guidance was there to help me. Otherwise, you have to go for the nicotine replacement therapy, counseling, and other support groups. You have to be join the support groups. Basically, counseling you will have to get.
I guess we are done with the Q&A session. Thank you, sir, for answering all the questions. And before moving on to vote of thanks, I would like to welcome and thank Jyoti ma'am for coming, avoiding all the busy schedules. And use of tobacco, one of the biggest threat to one's life. We never know when we'll get addicted to one. These feel good hormones like dopamine does the magic, which obviously gives a temporary pleasure, but you know its effects. It doesn't last long. How tobacco affects the way you look, its health effects, affecting not just us, but the ones around us, the ones we love. And Sir has explained everything beautifully, and it was definitely a much needed talk, especially for today. Thank you once again, Dr. Rajagopalan sir, for this wonderful talk. Before we move on, I would like to invite Dr. Achyutamrita Chaitanya ji to present the token of love from AYUDH Amritapuri to Raju sir. Thank you all for attending the session. Namaskar.